The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Little Miracles, the birth of baby Evan, and Kayla visits the ER. Megan Groves and her husband Adam are on their way to give birth to their first child. At 4 months, an ultrasound detected the baby's bowel was developing outside his body. After labor is induced at Mount Sinai Hospital, the baby will immediately be transferred to the Hospital for Sick Children for emergency surgery. 20 hours later, Megan has given birth to a baby boy. The baby's bowel is protruding through an opening in his abdominal wall. He is transported to the Hospital for Sick Children through an underground tunnel. His mother must remain in recovery at Mount Sinai Hospital until morning.
Hey, buddy. Come over here for a while.
If surgeons cannot place the bowel within the baby's abdomen, he will not survive.
All right, can I get you a chair?
No.
Okay. If you want this one here, you can sit with.
Your dad? Mm-hmm. Hi. Paul Wills from Surgical Fellow. We're Dr. Bechtel. Oh. Congratulations. Thank you.
What they're going to do is they're going to soak it and they're cleaning it. They're looking to see if there's anything wrong with the bowel, and then they're going to wrap it back up before they decide what they're going to do. Because that's our small intestines. They just want to see how much is out and what is affected.
8-year-old Kayla has been bitten by a dog. Police called to the scene have escorted her to the ER.
Honey, you're knocked into the gas mask.
No, I want the gas mask.
Okay, fine, we'll get the gas mask, okay?
You ask the nurse.
Ask the nurse.
They know the
About
best.
the dog, honey.
Does the dog have all shots? According to information we threw.
The dog rushed up to greet the kids, and within a matter of seconds, one of the counselors heard a growl, and the girl was screaming.
The dog probably got really nervous. There's a lot of kids around.
Why did it have to bite me?
Well, it's their reaction. They get scared, they get nervous. Like it.
Hello.
Can you put a gas mask on me? I've never been here.
Gas mask. I don't know the gas mask. Like the little face masks?
Yeah, that put you to sleep?
Oh, those. Oh, we won't talk about that yet. Are you okay? A bit frightened? Yeah, but don't worry. We're gonna look after you. You're gonna be just fine. It's okay. How's your eye? Is it okay?
Good, it didn't touch the eye.
Didn't touch you. That was lucky, wasn't it? Yeah.
I'm very lucky.
But just look over here, Kayla. Just look at the light. That's good. I'm just gonna pull this down a bit. Try not to hurt you. Good. Okay, your eyes look good. Okay.
It's very close, like right here. It's very close.
Yeah. There's 2 cuts there, you know?
I know.
You know that, and we're going to do that.
Where it bit.
Yeah. And what we're going to do is we're going to get another doctor in here, okay, who does a lot of the fixing up for cuts, okay? They're called plastic surgeons, okay? And they're going to come and have a chat with you very soon and get this whole thing sorted out. All right? Do you have any questions?
Are you going to put the gas mask on me?
Well, I don't know that. I'm going to ask the surgeon who comes. But don't worry. What they're going to do is they're going to give you something so you're not going to feel anything, all right? You're very brave. There are 2 deep cuts on the face, and that's going to require a plastic surgeon to come down and fix it up so that we get a nice result. The other issue is the possibility of infection, and that's not rabies. That's something else, just the bacteria in the dog's mouth. So Kayla's going to have to go on some antibiotics. Okay?
Okay, great.
Okay.
Thanks.
Okay.
Still haven't answered my question.
I don't think you're going to get gas, Kayla. You don't need gas.
It's the gas mask.
The
It puts you to sleep.
They don't need to put you to sleep.
But I don't want to
If you're not going to feel it, why put you to sleep? See, you'll be fine. No. Well, you keep telling yourself it's not going to be fine.
Yeah, 'cause it won't.
There's quite a bit of bowel out, so I don't think we'll be able safely to put everything back in tonight. So we'll try to just push the bowel gently back in a little bit at a time every day. We'll stretch the baby's belly also to try to make more space for everything else to come down.
Okay.
After a couple of 5 to 10 days, we'll put everything back in and then close the belly and then wait. So there's a certain amount of time by which we have to get the bowel in. All right.
How long is he going to be in surgery for?
Well, it probably is going to take half an hour before we get into surgery. The surgery will probably be like an hour and a half. Have you decided on the first name or?
No.
No, not yet.
Hello? Hi. You awake? Oh, good. Well, I'm just over here at SickKids, and so they've done their examination of him, and she says that the opening is fairly small, but Dr. Facto, and she said that the opening is fairly small, but there's a fair amount of bowel out, so she figures they're gonna put a silo on it, and she figures it'll be like 5 or 10 days before they can, before it's in. Yeah, he's still got 10 fingers and 10 toes. So, no, he's, they're prepping him for surgery. Okay, we'll talk to you later. All right, bye. You got daddy's gin or mommy's gin?
And when he comes back from the OR, he will get a morphine infusion because you can imagine with the bowel that's been exposed and having to manipulate the gut and to have to put that back in, it's going to be awfully horrendous for him.
That was one of the things that was bothering Mummy.
She's entitled.
Yeah.
You know, you expect a normal baby, and this is, this isn't normal for them. Okay, I'm just gonna close him up here so he stays nice and warm. And I'm gonna go up just if you want to come with us, Dad, and I'll show you where the waiting room is. Okay. Hey, Daddy.
Buddy.
Nice big kiss there. See ya. We'll take good care of him for you, okay?
Okay.
Hey, Kayla.
Hello.
Hi, hon. But you know what, hon? I just need to take a look at your hand, okay?
Oh, my hand.
Yep. Well, not that one. Let me take a look at this one, okay?
Why, nothing happened here.
No, I know, but you know we're going to give you some medicine, okay?
What's that for?
Okay, little band, help me see your veins better.
You're doing it
sweetheart.
tight?
Okay. But you know what? It's very quick, 1-2 seconds, and that's it.
Honey, remember the dentist? Yeah, I know, but remember the dentist? Remember you went hysterical and it didn't even hurt. Lie down, relax, let's get it over with. Remember the dentist,
I
honey,
want you
come
to
on.
put me to sleep, though. I want you to put the gas mask on me because I've never been here. It's freaking me out.
And just think, this isn't gonna hurt nearly as much as the dog bite, right?
We're going to lie down, and Mom and Norma's going to leave.
I said I wanted a hug, that's all.
Just come because then for the next really bad thing you'll be allowed to stay.
Don't fight us.
It's just a needle. Phil, it's gonna be just like
having a vaccine.
Wait, hold me as tight as you can, everybody. As tight.
Do your best not to
As
fight.
tight as you can.
Okay.
As tight. I'm gonna move.
You know what?
Well, don't try not
I'm
to.
gonna
sweetie.
squirm a lot.
When you feel
Out.
the pinch, you blow it
Good
out.
girl.
Blow it out.
It's all done.
Good girl.
Y'all worked up for nothing.
But it didn't even hurt at all.
Well, there.
So now you know.
Everybody was trying
Does that mean you want another one?
No.
No, we're just kidding,
Okay.
sweetheart.
I was hoping that maybe we could get her something to sedate her a bit. So I'm not sure whether you want to just do some oral midazolam or.
Was she given anything to start with for pain? Or
No, she's not in a lot of pain. It's anxiety. It's not a pain issue. She's
Okay.
really highly anxious.
okay. Hello. I'm gonna touch the wound there, and if it hurts,
Ow.
You're being very brave.
At the top it hurts, but down here it doesn't hurt at all.
okay.
Down here I don't feel it at all. You feel
She's got 2 penetrating wounds. They're not big, but they're right next to her eye. And if you happen to be injecting some local or irrigating, you might just plunge into her eyeball, and that'll be it.
Okay, so what's the solution?
So the solution is to put her to sleep.
Oh, she'll be happy about that.
Okay? All right, have you got the...
You want to stretch the belly a little bit? Over here. So we're stretching the belly because there's no space in that belly. It's never seen the bowel in. There's what we call a loss of domain here.
What is it, 1 in 20,000?
Yeah, about that.
Well, this is the hard part.
Beautiful.
Isn't that nice?
Fantastic.
And over the next week or so, squeeze it in like that. There you go. Okay, that's it. Done.
Kayla, my name is Jengus. I'm one of the anesthesiologists. Dr. Fisher here and I are working together, okay, kiddo? We've heard all about you. Let me tell you what we're going to do, okay? We're going to go into the room very soon. We are going to pick you up gently and put you over onto another funny-looking table.
I can walk.
Okay, well, you can do it yourself then. We're going to give you a little bit of medication through that intravenous, okay? It won't hurt. No more owies. That's right. And you have a little snooze, okay?
That's what I wanted, you guys to put me to sleep.
Well, she'll be fine. We'll take good care of her.
It's a good feeling, honey.
Okay, away we go.
Monkey has a belt.
Fair warning.
Yeah, I
she
saw
talks
that.
in her,
That's nice.
She talks in her sleep as well.
I know.
No kidding.
Yeah, you do.
Aww.
Hi. We're all done, okay? Everything went well.
Okay.
We put that silo around the bowel, as I said, and slipped it just underneath the belly wall. His bowel is still kind of soft, pliable, so I think things will fall back in easily.
Okay.
Okay?
Yeah.
So he should be back up here in about 15 minutes.
Okay.
Okay?
Okay. Hi, buddy.
He's got his eyes open. Who's Daddy?
Cute. Poor little guy. Very cute.
If you have any questions, Kelly can answer them for you, okay?
Okay.
All right.
46, yeah.
And we went to camp and I was between 2 sleepwalkers.
Here we are, kiddo. Watch out for that bump in the middle. I want you to come right across here, okay?
Hey, Bookie.
Okay, kiddo, can you lay down now?
Here for now. Oh, well, I usually sleep like this.
Kayla, now you have to listen to us, okay?
Are you gonna wait until I fall asleep to do the surgery?
Oh, yeah, definitely.
Okay, do I pull my shirt up? No. What are you doing?
You're going to be asleep before you know it.
Are they gonna poke a needle through?
Kayla,
Yeah. For now.
we're going to be getting you off to sleep, okay?
Okay.
So
Will it
think-
hurt?
Now, Kayla, just put your head right down. Put your head right down.
You're going to feel yourself
It
settle off
hurts.
to sleep.
It hurts.
Are you doing
It
fine?
hurts.
Okay, you're doing fine. It's going to be over in just a second.
That's it, cutie. Good for you.
That's nice.
Yeah? You like that?
Yeah.
You don't care, do you?
No, he doesn't care what his name is right now. When he's a teenager, he'll hate you no matter what your name is.
Things are looking good.
Are they?
Making some progress here. Well, if you consider we started here.
You want to ask? Okay, hang on.
Started, you know, about here. Down to there. I get the feeling it wants to push up, eh?
Yeah. Do you think that's enough?
I don't think this will give.
No, but I mean, do you want to try to push it more?
Oh,
We've pushed a lot more back in today, so hopefully by tomorrow we'll be able to push it all back in and then go zero.
You're okay. Yeah, that's better. You're a good boy. Yeah.
Much happier now.
Yeah. Oh, that's better. Oh.
pretty close to her eye. She's lucky.
Oh, yeah.
It would have been cruel to do this in the emergency.
Hey, but, yeah.
Deep, eh? Nasty. Really just a lot of irrigation. The goal here is really just to clean things up. Fairly loose to allow for fluid egress. It's a curvilinear scar, and when wounds contract, and we won't repair this as nicely as we would a surgical incision.
Thank you.
There she is.
Hi, sweetie.
How you doing?
It's
Oh,
okay.
It looks really good.
You see? Look at Daddy.
Very good.
Oh,
Very
yeah.
good, sweetie.
All clean. Remember where it was the
Very lucky.
the bite?
Very, very lucky.
It's a little line right now.
Here comes a mirror.
Wow.
But it looks like they did a nice job. It's all fixed up.
Still look pretty.
No, don't be so upset about it. It'll be fine.
Okay, so why don't you lie back flat on your back.
Here.
Scared.
But can they put me to sleep?
Nope. Here's the deal. When you tell me to stop, I promise I will stop, okay? I promise. Okay? You trust me? You ready?
She'll stop when you say stop. Just do the thing. Tickle.
Ow! Ow! Ow!
That's one.
You said you would stop.
You didn't say stop
didn't
yet.
say
You just
stop.
said ow.
Okay,
So
now
I
there's
think I'm
one
bidding
left,
high.
and this is right near your eye.
It's all over.
So you need
Cool.
to be really still for this one.
You'll be
okay?
fine because you're pretty brave, right?
Very
Close
still.
my eye.
Yeah, that's a
Good
good
idea.
idea.
You've been so good about getting this stuff cleaned and washed and everything. It's been really cool.
Done.
Wow, that was very good, Kayla.
Thank you very much.
See ya.
See ya.
No, for you, we did.
After 8 days, Evan has had a setback. His abdominal muscles have pushed his entire bowel back out of his body, undoing doctors' efforts.
Well, I think what happened yesterday is with the stretching, stuffing things back in, their whole in his abdominal wall is getting stretched out, right?
Okay.
Basically, we're back to square one, right?
Yes, we are.
Baby Evan is now 9 days old and time is running short. Doctors must find another way to encase the bowel and close the abdomen in the next few days. On the next episode of Little Miracles, Evan's struggle continues, and Ashley faces surgery.